Assalamu alaikum everyone. My name is Subhana Irfan and with me I have
Sabah Aslam.
and we are here to represent group number 4. The topic that has been assigned to us is Addison's disease. For most of you it must be the first time hearing about Addison's disease, but we will try our best to make it understandable for you. Addison's disease is a hormonal disorder caused by the adrenal or adrenocorticoid insufficiency, which means the body is unable to produce the adrenal hormones. Now, Sabha will be guiding you regarding what are the adrenal hormones.
So, what are the adrenal hormones? For this, you need to know what are the adrenal glands. Adrenal glands, also known as suprarenal glands. As the name indicates, supra means above and the renal means kidney. So, suprarenal glands are the glands which are located above the kidney. As shown in this picture, the adrenal glands are these two cute yellow structures, and maybe they are looking cute, but they are doing a lot for us. Now let's dive deep into the structure of adrenal gland. If I cut open the adrenal gland, you will be able to see two main parts, the adrenal cortex being the outermost part and the adrenal medulla being the innermost part. Now let us dive deeper into the adrenal cortex, but let us take a life jacket with us.
Thank you, Sabha. Adrenal cortex is further divided into three layers. The zona glomerulosa being the outermost layer, the zona reticularis being the innermost layer, and the zona fasciculata, which lies in between these two. Every layer or zone is responsible for producing a specific hormone, but we are mainly concerned with the aldosterone and cortisol. Talking about their site of synthesis, aldosterone is produced from the zona glomerulosa and the cortisol is produced from the other two layers. All the hormones which are produced from the adrenal cortex are divided into three main categories: the mineralocorticoids, the glucocorticoids, and the androgens. And once again, the main point of concern for us is the aldosterone and the cortisol. Now, if I try to classify these hormones according to the previously mentioned categories, the aldosterone is a mineralocorticoid, whereas the cortisol is a glucocorticoid.
Great. Now let's talk about the synthesis of these hormones. I will not be taking you through all the steps of synthesis, but both of these hormones have a common precursor, that is cholesterol. Cholesterol goes through a lot to produce these two champions, that is aldosterone and cortisol. Moving on, let's talk about what these champions do for us. Let us dig deeper into the functions of aldosterone. The three most important functions that aldosterone do for us. First, it increases the reabsorption of sodium. Also, water has a great affection for sodium, so it follows sodium osmotically. This helps to increase the blood volume, which in turn helps to increase the blood pressure. The second most important function of aldosterone is the excretion of the potassium. Last but not the least, aldosterone is also responsible for the hydrogen ion excretion from an intercalated cells of the kidney. Now to summarize, as shown in this slide, the three main actions of the aldosterone on kidneys are sodium retention, potassium excretion, and the hydrogen excretion. Oh, that's a lot of things.
Rightly said. Let's move on. Everyone and everything in this world needs regulation. So let us talk about the regulation of aldosterone. The mechanism that regulates the aldosterone secretion is known as the renin-angiotensin system. What stimulates this system is the low blood pressure and the low blood volumes. Whenever these two stimuli are received, angiotensin, which is a peptide hormone, it is secreted by the liver in an inactive form. This inactive form, angiotensin, is acted upon by renin, which is an important enzyme produced by the kidney. The renin catalyzes the conversion of inactive angiotensin to active angiotensin 1. The story does not end here. There is more to it. Another important enzyme, the angiotensin converting enzyme produced by the lungs, converts the angiotensin 1 to angiotensin 2. The angiotensin 2 has direct as well as indirect. The direct effects include the constriction of the arteries, which increase the cardiac output, resulting in increase in blood pressure. The indirect effects occur through the secretion of ADH and aldosterone. ADH is responsible for increasing water absorption from the kidneys. The function of aldosterone is already described by my fellow colleague previously. It increases the sodium absorption along with water and increases the potassium excretion. All these processes are collectively responsible for increasing the blood pressure. Now, let us wind up the regulation. There are three principal stimuli that increase the aldosterone production: the secretion of ACTH from the anterior pituitary, the angiotensin 2, and hyperkalemia.
Great. Talking about the second champion, the cortisol, which is classified as a glucocorticoid, as it is evident from its name, the main concern of the cortisol is to help to control the blood sugar levels, but it also helps in regulating the body metabolism, helps to reduce the inflammation, and assists with memory formation. Cortisol has different effects on different organs. As shown, in adipose tissue, it helps to increase the breakdown of fats. In pancreas, it counteracts the action of insulin, it reduces the bone formation, and in the liver, it helps to induce gluconeogenesis and glycogenolysis. Regulation of cortisol is a bit simple. Corticotropin releasing hormone released from the hypothalamus acts on the anti-pituitary gland to produce the adrenocorticotropin hormone, which has a direct effect on the adrenal cortex to produce cortisol. And this was all about the hormones. Everything we have explained this far is miraculously regulated and controlled thanks to our Creator Allah Almighty. But unfortunately, if any one of these steps are disturbed or defected, it can result in serious consequences. Addison's is one of them. Further explanation of Addison will be done by Subhana.
As explained earlier, Addison's is a condition in which the body is unable to produce sufficient amounts of hormones, the aldosterone and cortisol, resulting in the adrenocorticoid deficiency. There are two types of these deficiencies, the primary adrenal insufficiency and the secondary adrenal insufficiency. The primary adrenal insufficiency is the one in which the adrenal cortex is involved itself. 80% of these cases are autoimmune disorders which result in the atrophy or injury of the suprarenal gland. The primary adrenal insufficiency may also occur due to the tuberculosis of the suprarenal gland. The other insufficiency, the secondary adrenal insufficiency, occurs when there is a problem in the pituitary gland. This may be due to the tumors or head injuries of the brain, resulting in decreased production of ACTH from the pituitary and causing low cortisol production from the adrenal cortex. Coming towards the most important part, the signs and symptoms of Addison's disease. The most common symptoms of Addison's disease are shown in this slide, which include the bronze pigmentation of the skin, hypoglycemia, postural hypotension, changes in the distribution of body hair, GI disturbances, weight loss, weakness. In this slide, you can see a patient of Addison's disease with bronze skin color. There is no prevention for Addison's disease, but steps can be taken to escape the Addisonian crisis. Now, what is the Addisonian crisis? Addisonian crisis is a life-threatening crisis when the body is unable to produce enough cortisol in times of stress. This results in low blood pressure, low blood sugar, and high potassium levels. To prevent this crisis, timely treatment is required so the patient can live a normal life. The treatment mainly includes the hormone replacement to correct the insufficient levels of steroids, increase the sodium intake, and lifelong drug therapy is required. This is it from our side, but I would like to end the session on a fun fact. One of the famous Bollywood actors, Sushmita Sen, was diagnosed with Addison's disease in 2004, but she recovered from it because of the timely treatment.